Hi, I'm Dr. Chris Palmer, a low vision optometrist with low vision restoration in Minnesota. I see patients from all over the upper Midwest, North, South Dakota, Minnesota, primarily in Wisconsin and Iowa. I'm a member for 13 years of the International Academy of Low Vision Specialists, or IALVS, and it is the most inclusive, expansive, inspiring group of optometrists in eye care that I know of. So a good candidate for low vision devices are anyone that has vision that's not good enough to do what they want to do in their everyday life. So I want to tell you about an experience I had with a patient, which happens all the time, but in this particular case, what I call, and actually the patient called, her Easter miracle. So a few years ago, a lady got referred to me over Easter weekend from a colleague of mine in Arizona, and came up to see me in Minnesota. The miracle was that she had no hope. She was there to see, she had one eye, she was having a problem with that, and my colleague in Arizona had seen her for that and noticed that, well, her good eye doesn't see very well. She said, well, I've got a friend of mine up in Minnesota, comes to see me, and she brought a friend of hers that also wasn't driving at the time. And I was able to help both of them, and they had no idea prior that there was any kind of help for them at all. And they've been living with this. They had to quit their careers. Now the one is back working, and the other one is able to drive, to be able to read things and recognize her family and friends' faces in a way that she had not for years prior. And that's a common type of story that I and others, my colleagues around the country in the IALVS, deal with all the time.